Good evening. This is Congressman Andy Biggs. I am so grateful that you would join me on this teletown hall tonight. Thank you so much. I know other people will be getting on. And for those of you who are already on, I encourage you to, if you have a question, please press *3 to ask a question tonight. I'll try to get to as many questions as time allows. I'm very grateful that you would join me. Again, if you have a question, please press *3 to ask a question. I'm going to just start off with a few remarks, and we'll have some polling throughout the event, and we'll have again some questions. *3. So when I think about where we are as a country today, I'm thinking of some things that I just really have to address with you, and one of them is safety and security. I think all of us take the coronavirus issue seriously. We look at some of the social unrest that we see in the community. We're very concerned about that. We're concerned about jobs and economic distress and pressure that we're under. We're concerned about immigration issues, foreign policy issues, what's China doing. And so I think of some things that I hope that we can take hope in, and that is in the safety and security. We all want that for our families. We want it in our communities. We want it in our jobs and the economic environment that we live in. We want it in our health care and the decisions we make. We want to have more control over those. We want them to be able to make the health care decisions we think are important with our doctors, without government coming between those. We want to make sure that we can get the care we need for an affordable price. We think of safety and security for the unborn child. We think of safety and security in just so many aspects of our lives and the things that we want to accomplish, and so make sure that we can fulfill the great American dream that so many of us have been aware of all of our lives. And so we might get into that for a few minutes. But again, tonight, if you have a question, you want to get a question, please press *3. So I want to talk about the coronavirus for just a second. One of the things that we try to do in my office is follow the science and provide updated numbers. All these numbers that I'm going to give you are taken, it's data taken directly from the Arizona Department of Health Services website. That's what we look at. That's where we try to make sure we understand what's going to be. So first of all, I would point out is we do see an increased number of cases, although they are moving down. They're on the downward slide a little bit. We are detecting those cases through increased testings. But taking a look at those cases doesn't tell the entire story. For instance, hospitalizations. We're always interested in hospitalizations, and we look at those, and the percent of hospitalizations in Arizona has fallen now, whereas just a month and a half ago, we were at 11% of everybody who tested positive was being hospitalized. Now we're down to just under 6%, about 5.98%. On June 1st, the mortality rate for folks who got COVID-19 was at well over 4%, almost 4.5%, and today it's 2.05%, so a little over 2%. So you can see it's been cut in half, that mortality rate in just about a month and a half. Since June 1st, Arizona hospitals have discharged over 17,000 COVID-19 patients from their hospitals. And what we're seeing, there are enough ICU and inpatient beds available in Arizona's emergency departments. We keep track of that and get into those weeds if we need to. And one thing I want to add for context as well, because I think this is important, is that Arizona Department of Health Service, they report positive or suspected COVID-19 patients when they release their numbers. And I think it's important that policymakers really get a true context of these things. Last month, for instance, the CDC estimated that the United States may only be identifying 1/10 of positive COVID-19 cases. And if that estimation is applied to Arizona, if that were accurate, the percent of positive COVID-19 cases hospitalized would be 0.6%, and the mortality rate would be 0.21%. And one other thing is, just so you know, if you're in the age 20 to 44 category, the case fatality rate is 0.2%, very low. And I think those things help contextualize. It helps us understand a little bit better where we're going. So again, *3 for questions that, if you want to get in the queue for a question. And look, we've had increased unemployment. Our kids have been out of school, which experts say that there's more risk for the children being out of school than by being in school. We've seen lots of businesses permanently shuttered. We've seen a dramatic increase in calls to suicide hotlines. We've seen a very sharp increase in domestic violence. We've seen alcohol and drug abuse and addiction expand, and that's just a portion of the public health issues that we're trying to deal with on the other side. Now, Congress is considering an additional package of relief with regard to this. I would support some aspects of it. I think the president really is trying to get us to have a payroll tax holiday. I think that would be good. I think some of the PPP revisions would be good. And one thing that you may not be aware is there's more than $1 trillion from the last package which has not been dispersed. And so I'm struggling to understand why they want to have another package spending another $2 trillion or so, with knowing that there's $1 trillion still there. I think we need to have a liability protection provision. I've looked at Senate Majority Leader McConnell's. I'm not sure I like it. It's got some issues and some problems, we might hit on that. But one thing we got to acknowledge is that for every dollar we spend now, we're adding substantially to the national debt and our structural deficit. I would point out, if you have any issues with a federal agency or questions about unemployment assistance, please call my district office at 480-699-8239. That's 480-699-8239. You can find lots of information on my website at biggs.house.gov, including press releases, op-eds, podcasts, and much more. Again, please press *3 to ask a question. If you want to join the conversation, you can go on Facebook at Rep. Andy Biggs, Twitter at Rep. Andy Biggs AZ, Instagram at Rep. Andy Biggs, Parler is at Rep. Andy Biggs, YouTube is Rep. Andy Biggs, and website is biggs.house.gov. My district office number, again, is 480-699-8239. And now, again, if you want to get in the line to ask a question, we'll try to take as many as we can tonight. *3 is the way you get in that line. And now we're going to go to some questions. And our first caller tonight is Valerie from Mesa. Valerie.
Hello.
Hi, Valerie.
How are you?
I'm great. How are you doing tonight?
Good.
Good. Do you happen to have a question for me?
Yeah, my question was basically about the virus thing, because the information tends to be, it's all over the place. You never know what is actual facts. You just cleared up some of them by the way that they report stuff. And my concern really is for my grandbabies. They're my life, and they need to be in school. I have 3 older ones. 2 are going to be junior high. One's still in grade school, and they're going absolutely nuts. All they do is sit around, play video games, sleep all day. They're just miserable. And my concern is getting these kids back into school where they can see their friends and be active and doing things.
Yeah, Valerie, thanks so much. I'm going to talk two quick things in relation to what you just talked about, is data and how to get accurate data. Well, I know that I spend time every day, and my staff spends time every day trying to track down data from the Arizona Department of Health Services, and I look and compare other states as well, just trying to get a feel for it. I also look at information that's being put out by doctors and scientists around the country and around the world, quite frankly, to see what's going on. And one thing that we do know is that you can get data, but you have to put it in context. And a lot of times there's just raw data out there. And so I encourage you to follow us on Twitter, because we put up data in context every day. And it's all based on what we're seeing from Arizona Department of Health Services. Occasionally I'll put some data on that we see from around the world or somewhere else in the United States to give some more context. But opening up schools, I will tell you, Valerie, I get a lot of calls every day from parents who want their children back in schools. The American Academy of Pediatricians who walked back, one area did not walk back this. They said there's more risk to children being out of school than being in school. I think that's true. I don't think we'll ever get to a place where it's absolutely zero risk. I don't know of anything in life that's zero risk. But I think what we should be talking about is how do we mitigate risk and fear. And the reason I brought the 20 to 44 age demographic and what happens there, by the way, half of our positive tests are in that age demographic, is because they do very well. They do very well, and we want them. We want our teachers to be protected as well. But I think we need to get the kids in school, and I don't think I'm alone in that, but I appreciate your call, Valerie. We're ready now to go to Vincent in Mesa. Vincent.
Yes, Congressman. How you doing?
Great. Thanks for calling in.
No problem. Thanks for having this meeting. These are very useful. I find them very useful. A couple of things. I just happened to sit in on the hearing yesterday. I got to tell you, the left side of the aisle scares me to death. These people are as reckless as they can be, and I want to actually compliment you on your outstanding performance that you have done in your position. And if you would be so kind as to extend the same to Jim Jordan, that would be great.
I'm happy to do that, Vincent. Thank you so much.
The issue that I have with these folks, and that's the left, that is the reckless non-wisdom decisions that they try to make, and especially when we're talking about more funding for emergency care, the relief. I understand it. I get it. I know what the president's trying to do, but these people need to get reeled in. I mean, they just really do. I mean, they just want to throw money at things and then say that we had to do it, and there's no true sensical response from them. So if there's some way to fight that, or if the president can fight that and Mitch McConnell can fight that, that would be phenomenal, so that we don't get buried. I mean, because if they get in the power, they're going to tax us to the point where we're not going to even bother to work. It's crazy.
Yeah. Vincent, right, great points. And I'll just tell you, the bar hearing yesterday, if you want to we can get more into that. I was very dismayed at the way my colleagues on the other side would ask a question, and when he went to answer, they would reclaim their time, which is a device that we typically only use when we're actually addressing each other. So I might yield a question to a colleague across the aisle. They'll ask the question, and I'll reclaim my time to answer it. This notion that you're going to ask or make an accusation against a witness and then not let them respond is really something that I had not seen very many times in my short time here. The other point that you were making, I want to address that, and that is one of the things that just concerns me. We can't even actually keep our national debt clock up to date. It's moving so fast here in Washington, D.C. We have added something in the order of $3.5 to $4.5 trillion in national debt in the last 2 months. And they're talking now, the Senate Republicans are talking another $1 trillion. House Democrats want another $3 trillion, and I'm scared to death that we're going to get somewhere in the middle of that, around $2 trillion. So our national debt will be somewhere near $30 trillion. And with our GDP where it is, because it kind of shrank there in the early parts of the lockdown related to the virus, we actually get upside down on debt to GDP. In other words, we will be owing so much more money that it has the ability to cause a sovereign debt crisis, which is not good for the United States of America. And so I think what we have to do and what we need voices to do, you're asking what you can do. I think you just have to consistently make sure your voice is heard on this particular issue, and I will continue to make sure my voice is heard on that issue as well. So, Vincent, thanks so very much for the call. We're going to go to the first poll question, and before I do it, I just remind you to go to *3 if you have a question. We'll try to get to as many questions as we can. Here's the first poll question. Are Arizona's children more at risk in school or out of school this fall? Please press 1 for yes, 2 for no, or 3 for unsure. Let me tell you again. The question is, are Arizona's children more at risk in school or out of school this fall? So the question is, we kind of worded this poorly here, so I'm gonna clean it up. The question is, are Arizona's children more at risk in school this fall than they would be out of school? If you think they'd be more at risk in school, press 1. If you think no, they'd be more at risk out of school, you're going to press 2 for no and 3 for unsure. Okay? A little bit confusing, but I hope you understand. So with that, we're going to go to Karen in Mesa. Hi, Karen.
Hi. Thank you for taking my call.
My pleasure. Thank you for calling tonight.
I have some concerns about the legitimacy of the tests, knowing that there have been people that signed up and checked in and then got tired of waiting and left. This was a family of 4, and a week later, they were sent positive test results. I have a friend in California that it happened to also. I think we need to check the labs that are doing this to us, because this whole thing is turning out to be a farce if that's happening.
Yeah, I will tell you, Karen, that's not the first time I've heard incidents like that happening. And quite frankly, I'm going to give you one that I think should give us all pause. And that is the test that you take when you go to see the president in the White House. I have known people who go and they get the test and it'll show positive, and then they'll say, I don't think I have no symptoms. And so it's not unusual for them to immediately give them the test within 5 or 10 minutes, and that test, I know of cases where it's immediately come back negative. So at least that test is not even accurate. I know Dr. Deborah Birx, who is on the Vice President's Coronavirus Task Force, said a couple months ago, she said we are overestimating COVID-related deaths at least by 25%. That's the minimum that we are overestimating. And the CDC itself said that we are underestimating the total positive COVID-19 incidence by a magnitude of 10. So when I'm like you, I can only work with the data that we have available. I am skeptical at how accurate it is, and I'll tell you one other thing that you might have seen. If you looked on the data that was available yesterday from the Department of Health Services, you would have seen what I consider to be a miracle, and that was when it said newly reported fatalities, it had -1. Now, I don't believe that that's what they meant to have there, but that's what was there. And at the same time, you're seeing numbers that just don't seem to jive. So fair question, and I'm glad you raised it, and I appreciate it very much, Karen. And now we're going to go to John in Tempe.
Good afternoon or good evening, Congressman.
Hi, John.
And thank you for your service to our country. The concern I do have is people spending hours in a car to get a test and then have to wait 3, 4, maybe 5 days longer to get the results back. Meanwhile, if the tests come back negative, they could have easily contracted this disease in that waiting period, and it is beyond conscionable thinking to get a test today, wait maybe 10 days or so to get the results back, and think everything is okay. Our government, I know, is trying to do something, and they are, but to this type of conversation between the media and people like myself, it's not good, because even the CDC doesn't have the correct right answer. They're looking for it. I'd rather hear we don't have the answer yet than a whole bunch of malarkey. It's disheartening.
Yeah, no, hey, John, I couldn't agree more. I'll just offer you a couple of anecdotes that'll aggravate you. Not that I'm trying to aggravate you, but but I sense your aggravation, so I thought I would share them. So we had, for instance, one of my staffers. I can't remember how she got exposed to someone who had tested positive. So our protocol here is if we find out you've been exposed, you go get your test, and you have to work. You work from home. You can't come in until you either get the test results back or you go through the quarantine period. Well, she went through the entire quarantine period and still has not received the test back, and so it doesn't matter anymore because now she's beyond that. But you're right. If you're basing your isolation or whatever you want to call it on this test, it just doesn't matter. So much of this needs to turn on how quickly you can respond with getting your test results, because that impacts how you act, how you respond to this, and it's a crying shame that we're not getting these. And that kind of goes with the issue that Karen mentioned just a moment ago about some of this stuff just comes back and seems to, somebody gets a positive result even though they left because they couldn't stand waiting in line that long. So I know that the testing companies are trying to deal with it. At the beginning, when this thing first happened, they were able to turn around tests very quickly because they weren't overwhelmed. Now they're overwhelmed, and I know Dr. Kara Christ said last week that the testing facilities at the biggest lab was adding a third line so they could try to process more tests because they were literally behind in processing tens of thousands of tests. So hopefully they'll start being able to get that done more quickly. There's no doubt about it. That's another one of the issues that we face is timeliness of response. The other thing I would just tell you that I've known, and I don't understand this. I've had some members of Congress able to get their tests back the same day, and other members of Congress not get theirs back for more than a week when they get a test. And so it's mind-boggling that American citizens are having such difficulty getting the testing back. So, John, thanks for calling in. Next, we're going to go to James in Mesa.
How you doing?
Great, James. Thanks for calling in tonight.
Well, we appreciate, speaking for my friends and family, we appreciate everything you're doing, and especially your stance and standing with President Trump on a lot of the issues.
Thank you.
What I'm concerned with, I'm over 70 and in that at-risk group, and I'm concerned that Governor Ducey won't rescind his order that's denying Arizona's access to the drug hydrochloroquine for the prevention of COVID-19. The only way you can get a prescription is if you've got it, if your doctor does it. But I feel it's necessary for folks that are in my position to have access to that drug to try to help us prevent it, keep it out of our homes and out of our families.
Yeah, so James, thanks for the comment and question. So, and I appreciate you calling in. So let me address that just briefly. Hydroxychloroquine has been given and approved by the FDA. I want to say almost 70 years now, and there's very few incident reports that have gone to FDA over that time. I want to say the number is like something like 57 total complaints in the 60 some odd years. The documentation on it is overwhelming, and with that, I'll just tell you that next week I'll be speaking on the floor of the House regarding hydroxychloroquine, and I'll be providing lots of data and information. And we have a stack of studies here, and I've talked with many doctors, epidemiologists, and experts, as well as rheumatoid arthritis specialists who deal with this, and they're going to tell us, and cardiologists as well will tell you that they're, and I won't get into the weeds with it right now, but it is a drug that the FDA long ago determined is safe. That is safe. It doesn't mean that you should just use it willy-nilly without consultation with your doctors, but it's determined to be safe. So I'm a big believer in right to try. So I led the legislation on right to try here. And the right to try legislation was to say, if you get past phase 1, which is the determination that a pharmaceutical is safe, then somebody who has a fatal illness should have the right to try that drug to have the choice. I think we should expand the right to try doctrine. It's not in the law because this wasn't in the bill that we passed, but the doctrine, hydroxychloroquine, is this: if it is safe, then you should be able to take hydroxychloroquine in consultation with your doctor. By the way, this drug is over the counter in many nations around the world, everywhere from Central America to places in Africa and Central Asia. It probably should be allowed, and it works tends to work with zinc. So the point is, even if you don't think it works, if it is safe, you ought to allow people to make that decision for themselves. I'm a big believer in that independence and that right that people have. So thank you so much, James. And now we have, just to encourage you to press *3 if you have questions. We're going to go now to the poll results that we have here. So let me remind you what the question was. Are Arizona's children more at risk in school this fall? And 10% of you said yes, that they're more at risk going back to school. 81% said no, they're more risk of being out of school this fall, and 9% were unsure. Appreciate everybody who responded to that poll question. We're going to have another poll question in a second. If you want to ask a question, please press *3. We're now going to go to Leonard in Chandler. Leonard.
Yeah. Yes, thank you. My question concerns the stimulus plan, package where you're putting in a payroll tax cut, or proposing a payroll tax cut. Payroll tax cuts tend to be used to stimulate the economy when there is full employment but not enough economic activity. In this case, we have 10 to 20% unemployment and soaring debt because of the stimulus plans. So reducing the tax revenue seems like a totally fiscal, irresponsible plan. So I'd kind of like your comment on that.
Hey, thanks, Leonard. That's a great point, and I'm glad you asked it directly, and I love that. So let's consider for a second. The actual unemployment rate is about 11% right now, 11.5%, and I think it's actually higher. That's roughly the reported. I think it's probably higher. We're fighting right now the incentives of the $600 bonus unemployment payment, which expires at the end of this month. And my Democrat colleagues want to extend it and actually increase that amount, which adds directly to the unemployment, and to the national debt. But it also provides an incentive. The incentive not to work is because 75% of American workers make more money with their state unemployment with a $600 a week bonus for unemployment that the feds were giving. So 75% of Americans make more by staying home. That's a disincentive to get back to work. On the other hand, if you reduce it down to the $200 to $300 that some Republicans are talking about, the Democrats, like I said, they want to keep it at the same level it's at, but Republicans in the Senate want to bring it down to $200 to $300. What you would have is 50%. So the 75% rate drops to 50%. So 50% of American workers still make more with unemployment plus the federal bonus. If you go to a payroll tax holiday through the end of this year, the impact is less than the $600 or $200 unemployment bonus. It's a good question to ask. I would rather we provide incentives to get back to work. I hear from businesses quite a bit and have over the last month and a half, as they've tried to open their businesses, they can't get employees to come back. And we want employees to get back to work and reduce that unemployment rate. And so you, by reducing that payroll tax for a short period of time, certainly not past the end of this calendar year, your impact is far less on the national debt because you're going to get people working and consuming and offsetting that to some degree. I don't know what the dynamic score of that is. I'm the first one to admit that, but I will tell you that is, in my opinion, a more rational approach than incentivize people not to work. And so with that, I really appreciate the question. That was a great question. I'm going to go right now to poll question number 2. And poll question number 2 is this. Do you support the government mandating masks in public in response to the COVID-19 outbreak? 1 for yes, 2 for no, 3 for unsure. Again, I'm asking, do you support government mandating masks in public in response to the COVID-19 outbreak? 1 if you do support that, 2 if you don't, and 3 if you're unsure. And we'll get back with that after we get some results. And now we're going to go to Wayne in Gilbert.
Congressman, you're doing a great job. I support you and your platform and the Republican Party. Served 6 years in the Marine Corps in the 60s. And,
thank you, Wayne.
Thank you.
Thanks for your service,
Wayne. I went in 3 weeks ago and was tested positive at the hospital, emergency room. Came home 4 days later, doing great. 76 years old, and the people in those hospitals are really serving this community. And I appreciate your service. I have a daughter that was valedictorian in high school, graduated ASU, and went off into the world of drugs. It's been an 8-year battle. We've not given up. We're a Christian family. Son that's a pastor in Dallas, and I'm praying that I wrote President Trump that we have another virus called drugs in this country, and there's good people that get into drugs, and then they become a different breed. And I just wanted to encourage you, if you have the opportunity. We have great scientists and great technicians. My prayer is that, and our pastor Eric Jones knows you and supports you as well. Our church does for your efforts, and we appreciate it. But if the president and the scientists, if they could put their hearts to this after the virus, I would really appreciate their effort.
Wayne, thank you so much for the call. Thank you for your service as a U.S. Marine, and you're exactly right on a couple of points. I want to join you in thanking our frontline medical personnel in the hospitals. They're doing a great job. This isn't an easy job, and I tip my hat to them. I have no criticisms of them. They're doing the very best they can, and I'm really, really appreciative of them. And then you mentioned Pastor Eric Jones, who's a good friend of mine, and his wonderful wife Velvet. They're great. And convey my love to them if you would. And you touched upon something I think that prior to this virus outbreak and epidemic, I think we were talking and trying to find ways to incentivize developments of responses to drug use and addiction, for sure. And I'm with you. I think when we see opioid and drug addiction, and I would say alcohol addiction too, touch so many people in our lives. I think we've all seen that with people that we love and that we're close to. We've had that experience, and so we want to make sure that we address that. So there's so many ways to get at it, but not the least of which is, you're right, we do have very ingenious scientists and technicians, and we in Congress probably ought to look at how can we provide the best market-based incentives for these very creative, ingenious people to come up with solutions. And I will keep that in mind, and I'll pass it on to the administration as well. And also I want to say congratulations to you. I'm glad that you survived your bout with the COVID virus, and that you're back healthy and well, and well done. Well done. I'm grateful for that, Wayne. Next, we're going to go to Sandy and Gilbert.
Hi, Congressman Biggs. I want to say
Hi,
that
Sandy.
you're doing an excellent. I want to tell you that you're doing an excellent job, and keep up the good work. My question is, I follow Hold 2 on Twitter, and he said that 8 days ago, DHS stopped reporting death certificate matches. Can you explain what that is, and why do you think they would stop reporting that?
So thanks, Sandy. Thanks for calling in. Appreciate it. So death certificate match is where they go back and they're looking at deaths and trying to match up the cause of death and then include that in the data. One of the things that statisticians are looking at with COVID is what we call excess death. Now, this sounds really morbid, and I hate to use it, but this is what statisticians look at. They're looking at excess death. So, for instance, in any given year, you would expect X number of people within a certain age group or certain demographics to die, and so they're looking to see if you've got anything above your normal match. So if it was 5,000 and you've had 5,500, then you would try to find out why you had that excess fatality number. So death certificate match is a way to go in and kind of match up the cause of death. And it can actually skew statistics, because the way statistics are reported in Arizona anyway, they don't do it by date of death, for instance, when they're doing that death certificate match. They're doing it by date of reporting of that death. So if you find somebody 2 months ago that has passed away because of the death certificate says on a COVID, and you report it today, then it kind of skews it because the death actually took place 2 months ago. So I hope that clears up a little bit anyway with the death certificate matching. So again, for others who wish to get in, if you press *3, we're going to take some more questions. The question on poll question number 2 was this: do you support the government mandating masks in public in response to the COVID-19 outbreak? We had 30% said yes, 62% said no, and 8% are unsure. I appreciate everybody who participated in that poll. So the question again was, do you support the government mandating masks in public in response to the COVID-19 outbreak? 30% said yes, 62% said no, and 8% said they were unsure. Thank you so very much for participating. Next, we're going to go to, next question is Renee in Mesa. Hi, Renee.
Hi. Thank you for taking my call, and I so appreciate your service.
Thank you.
So, as a senior, we're all concerned, and one of the benefits of being older is we have our silver sneakers. Well,
Right.
with the gyms being closed, we're putting ourselves at greater risk by not getting out and doing our exercises and staying healthy, and we really do need to get Arizona open back up again.
Yeah, Renee, thanks for the question. I'm with you. I've talked to some of the gym owners around, and I don't want to be overly critical of the governor. I know he's got a tough job on his hands, but the closing of gyms really bugs me, and I'll tell you why. Because that's where people are going trying to get healthy, and the gym owners that I have spoken to went out of their way to comply with CDC guidelines and directives from Arizona, actually. So they were moving equipment so you'd have social distancing. They were installing hand sanitizers. They were some of them actually came in and paid a large amount of money to get their facility essentially sanitized. They put in place protocols to try to make sure equipment was clean and washed down. They were moving to online reservations, so they would have control over crowd control. I really don't understand why we saw the closing of the gyms, and I think, you know, I'm supportive of reopening the gyms and letting people make the choices. And the gyms are trying to mitigate liability. They're trying to mitigate risk. They're trying to provide a healthful environment. And to me, I look at it and I just say, this is something that mystifies me. So I continue to advocate, Renee, and I know you're advocating it. Sounds like I think our seniors, but I think the entire population that goes to gyms, for the most part, they're trying to better their health, and that's kind of what I think needs to happen when we're dealing with this epidemic right now. Next, we're going to go to Cheryl in Mesa. Hi, Cheryl.
Hi, Congressman Biggs. I appreciate all you do.
Well, thank you.
Wondering what, if anything, we can do to get things open back up. The businesses are dying. There aren't going to be jobs when people can go back to work. People are depressed. The list goes on and on. This is just deadly to keep doing this, to keep extending it like this. What can we do?
Cheryl, I agree with you. I'm really concerned because the data is coming in from all over the world now. There's studies out talking about the lockdowns and their negative impact. I don't know if you saw this, but about a month ago, the U.S. Census Bureau released a survey they did. They sent out to 1 million people, 48,000 responded. In that survey, they embedded 4 questions determining clinical depression, 4 questions that psychiatrists and psychologists use to help them to determine clinical depression. And they determined that a full 35% of Americans who responded, that 48,000, would meet the criterion for clinical depression. As I mentioned earlier, public health issues abound because of the lockdown and quite frankly, the uncertainty that comes with this as well. So I believe there's some things. I think we need to continue to encourage our elected officials to support opening up businesses, and I think Congress and I think the state legislature needs to also deal with this issue of liability protection. I know I've talked with some businesses. They're very concerned that if they do open up, they want to open up, but if they do open up, that aggressive trial lawyers are going to come after them and sue them if somebody claims sickness or what have you. So we need to take care of that. The feds can deal with it where we have federal jurisdiction, but the state legislature has to deal with it where they have jurisdiction, and so that requires the governor and the legislature to get back in special session on that. The other thing I wanted to say, because your question, I think, implies is this even constitutional? I would assert most vociferously that when the state and local jurisdictions shut down businesses, it's a tantamount to a taking. it's virtually an eminent domain issue, and you would need to do that. I'm hoping that there will be this question brought up, because how do these jurisdictions close down businesses? And so if I have a small, let's say, a golf shop, for instance, I sell golf clubs, I can't let people in, and I still have to pay rent. I have to pay for my product, my inventory. I have to pay for marketing. I have a lot of overhead that I have to take care of, but I don't have any income. That's why businesses go out and then shut their doors, and many will never reopen. And at the same time, they chose different stores and said you can be open for that. But for instance, you can't go to worship in churches. The inconsistency has driven me crazy, and I would just suggest to you one other thing, that it appears to me that it is tantamount to a taking, and that means I think that people could actually bring lawsuits to try to recover their losses. Now, having said that, I'm speaking as a congressman and not as a lawyer, and would encourage you to those who are considering that to visit with a competent lawyer who deals with these types of issues and determine whether that's whether they think you have a valid case or not. But I mean, that is my concern, that the government has taken some of this, and that's a problem. We're going to next go to Jason in Mesa.
Good evening, Congressman Biggs.
Hi, Jason.
Hope you're doing well.
Thank you. I hope you are as well.
We're doing real well. Trying to hide from the heat. It's awfully warm here right now.
I recognize that it is. Yes.
Hey, quick question about the EIDL loans.
Yeah.
And maybe just be more of an opinion than a question. People obviously are taking these because they're worried about cash flow. You were just actually speaking sort of to this. And I've taken one myself, and I haven't had to use it yet, thank goodness. But I'm a little put off by the interest rate, 3.75% on that. I was just curious, is there any conversations about, making future ones at a lower interest rate, or perhaps a Fed's fund rate, something like that, a little more equal? Am I off on that at all? What's your opinion?
Jason, so
your time.
Yeah, thanks for calling in, Jason. So I've been reviewing I haven't been reading the Senate version of their proposal for a couple of reasons. First of all, I'll just tell you, it's really long, number one. Number two, it doesn't seem to be going anywhere right now, and the House, Nancy Pelosi wants to do something different. But what I have seen is that there is an effort to try to deal with EIDL loans and provide a lower rate. We'll see how that plays out. But that is what I'm hearing right now, because you're right. The Fed's fund rate is really it's almost zero. I mean, that's what you really have to get down to it to see how low it is. But we'll see how that plays out. But that is, so your question really is, what's going on there? There is discussion on that going on in Congress right now, on the Senate side, as they're working on the next relief package. So we'll try to keep you posted on that as we go along. Thanks for the question, Jason. And by the way, I'm glad you haven't had to use that EIDL loan yet. We're going to go down to poll number 3. That one is, do you support the passage of a $2 to $3 trillion relief package in the next week or two? Let me repeat that. Do you support the passage of a $2 to $3 trillion relief package in the next week or two? Press 1 for yes, 2 for no, or 3 for unsure. That's 1 for yes, 2 for no, 3 for unsure. The poll question is, do you support the passage of a $2 to $3 trillion relief package in the next week or two? And now we're going to go to Gary in Mesa. Hi, Gary.
Hello, Andy. Congressman Biggs. Sorry.
You call me Andy, that's for sure.
Well, a little history. I'm 86 years old. I'm a retired airline pilot from Delta Airlines, and I'm a former Marine. And my wife is 72 years old, and she retired after 45 years with Delta Airlines as a flight attendant. Now, number one, I pushed yes on that relief package because we are on limited income, fixed income, and we need all the help we can get right now. However, if it's going to be controlled by the Congress and the Senate, when I say that, I'm talking about Pelosi, the idiot, and the other idiot that's the senator, head of the Senate. I think that both of them need to be excused from office. But getting back to what I was talking about, and I think you're doing a wonderful, wonderful job. I've listened in to the hearings, and to hear what comes out of the mouths of the Democrats, and I'm going to tell you right out front, I believe that the Democrats, all of them, got no business being in office. Most of them, they're dumber than dirt. And I think that they are the one exact cause of the dumbing down of the United States of America. And I love this country with all my heart, and I love Arizona too. I was born and raised in California, but I wouldn't give you a nickel for it. Anyhow, the way I feel about what the Democrats have done to this country, and particularly in the last 10 years with the last group that was in there was absolutely devastating. I mean, if this guy, this jerk that's running for president makes it, I don't know where I'm going to go. I probably won't live much longer. I'm 86, like I said, and I've had a lot of surgeries. But the thing is that I feel that we aren't getting any better here, not with the Congress and the Senate that we've had. I think Trump is doing a wonderful job. I think the Republicans are trying to do a wonderful job. The problem is that they got their hands tied. Either that or a lot of them don't have backbone.
Yeah.
But yeah. So I think you do. I listened to you. I listened to the hearings yesterday. As far as I'm concerned, it's just another bloody nose for the Democrats because they asked them. I mean, you can't fix stupid. That's an old Marine Corps thing. And I'll tell you what, those people are stupid. I can't say anything else, I guess. Otherwise, I'd get cut off.
Well, Gary, thanks so much for the call. I really appreciate it. Appreciate your service in the Marines, and you never know. You might have 20, 30 years left. I mean, you just play your cards right and go with it. But I'll just tell you, we are dealing with a lot of serious issues here, and the constraints that will be put on whatever is the spending. I mean, it's going to be almost limitless. This notion of $2 trillion spent over a period of about two months is mind-boggling to me. And in any event, I sure appreciate your call and your service, and best to you and your wife. And we're going to go next to, I'm going to give you the results of the latest poll, which the question was, do you support the passage of a $2 to $3 trillion CARES package or relief package in the next week or two? And the answer, the results were 16% said yes, 70% said no, and 14% were unsure. I appreciate all who participated in the poll. So now we're going to go to Mark in Mesa. Hey, Mark.
Hello, Congressman. I hope you're doing well. Appreciate your service.
I am. Thank you. Thanks for all you do, sir.
We need to have breakfast again one of these days when we're allowed.
I think we're allowed. We just have to sit at different tables.
Fair enough. You schedule it. I'll be there.
All righty.
Hey, my question, Congressman, is about the Federal CARES Funding Act, that the monies that have been distributed to the municipalities in your district. What's your perception of that, and how do you think the municipalities are doing funding that money and putting it down into the businesses, our small businesses, and even large businesses in our respective communities? Just your thoughts on that.
Mark, it's I'm embarrassed to say this, but I don't have granular detail on what, say, Mesa, Gilbert, Queen Creek, or Chandler have done. I've had some general information, but I'm kind of uncomfortable unless I get more granular information. Now, I can speak in a more generic way and give you some examples from different places around the country. In Georgia, there was one county and one municipality. One got like $350,000, and another got $1.2 million. And the administrators there, of course, said we didn't need the money. We could make ends meet, but we didn't need the money. And they actually perhaps rightfully so, perhaps wrongfully so, they said they chose to keep it in their community. So I'm not real sure, Mark, what to tell you on how my opinion is on how that money is being distributed in a micro fashion. I'm uncomfortable commenting on that, but I tell you what we will do is I've taken a note here, and we're going to try to get more information tomorrow from all 4 of the cities in our district. So then we can have that breakfast, and I can answer this question more fully. So I appreciate you calling in. Now we're going to go to Gene in Mesa.
I heard you, first of all, thank you, Congressman Biggs. You're doing a fantastic job for our country.
Thank you.
Earlier on in our discussion tonight, you were talking about you're going to be giving a talk to Congress related to the hydroxychloroquine. And I was just reading an article today on One News Now, which is a reliable source, and it talks about the doctors that gave a talk on the Supreme Court steps on Monday and Tuesday. I guess they called themselves America's Frontline Doctors. One of those doctors was Dr. Stella Emanuel, who is the doctor that President Trump has mentioned on several occasions, and he follows her advice. But one of the things she said is, I came here to Washington, I'm quoting now from this newsprint, I came here to Washington, D.C. to tell America nobody needs to get sick. This virus has a cure. It is called hydroxychloroquine, zinc, and zithromax, she stated. We don't need masks. There is a cure. And then she goes on to talking about, we treat them and they live. This is her quote from her. We treat them and they live. None has died, she continued. There is no way I can treat 350 patients and counting, and nobody is dead, and they all did better. And you're going to tell me that, well, then she's kind of lambasting the other political answers that people give. But I'm just hoping that you'll get a chance to see what these doctors had to say. There's about 8 or 10 of them that spoke on the Capitol steps. And I think they're confirming what a lot of us are already thinking, that there's some kind of a farce going on here as far as this coronavirus.
Yeah, that's a great point. And I will tell you that I had a chance to talk with some of those doctors, but I've also talked with other doctors and epidemiologists from around the country, including those who teach at med schools and actually also are frontline doctors elsewhere. And this is one of the reasons I've advocated that Drs. Fauci and Birx have too much power, and they should allow other voices to be heard. Because again, we get back to this notion that the drug is safe and there should be right to try. And hydroxychloroquine is extremely inexpensive, and the U.S. has bought up a tremendous amount of stockpile of that medication. I think it's something that we need to be looking very seriously at. I read a statement from Dr. Frisch out of Yale University, who said that, in his opinion, that as much as 50% or more of the fatalities due to COVID would have been avoided if we had used hydroxychloroquine and a zinc remedy. And I think that we've got to move in that direction. I think if this turns out to be true, then we have a really difficult question to answer, and that's why some in this medical pharmaceutical establishment pointed us in another direction. And the data is coming in from all over the world, and it's interesting to see. But we're going to continue to do more on it and try to present data and facts and information, and hopefully we can get that out to the public and let the public make a determination on that, and hopefully change the direction we're going. Next, we're going to go to Travis in Gilbert.
Hello, Congressman Biggs. Thanks for taking my call.
You bet. Thanks for calling, Travis.
Well, Congressman, you had touched earlier and on that poll about our debt, and now we're staring down the barrel of anywhere between $1 to $3 trillion relief package. And for me, when you start talking in the trillions of debt, it's kind of hard for my mind to wrap around it. So, I kind of relate it to my own household income, and this is kind of my rough calculation, but this isn't any way scientific. But for example, I kind of bring it down to, instead of the trillions of the federal government, to my own household. If I make, say, $60,000 a year, but I consistently spend $70,000 a year, I'm going to be in debt $10,000 a year and still have $400,000 or $500,000 in debt. So someday I'll have an ugly problem on my hands if the national debt was just brought down to a household kind of thought process. So it seems like many in Congress find it easy to spend money when it's not their own money. I mean, if they had to open up their own personal bank accounts and their own household debt, would they be, so free with the money? So, my wife and I, we're young, we're in our 30s, we have 3 girls that are 6 and under. What can we do to ensure that these COVID relief packages that are in the trillions don't ruin our family's financial security?
Travis, great question, and your points are well taken, and I'm grateful you called, because I just want to explain a couple things and then try to give a warning sound, and if I can, maybe provide some measure, even if it's small, of hope. So, Travis, you talked about making $60,000 and spending $70,000. Try making $60,000 and spending $250,000 or more a year. That's really kind of what it's like. Before the COVID lockdowns took place throughout the country, we had the highest tax revenue in the history of this country. But we still spent $1 trillion more than we brought in. But so by February, the fiscal year here begins the October 1. By 6 months in, we were already $1 trillion in structural debt. We knew that we would spend $1 trillion more than we were going to receive. And then when the lockdown came, which is what some of us have been saying forever, which is you can't keep, this is unsustainable, because if you ever have a hiccup, if you go back to 2008 or anything like that, you add to your national debt. And so that's what we've seen here. It's been massive. It's been massive. And so we spend way, way, way more than we brought in. Normally, a lot of that money is going to increases in certain programs that we have basically contractual obligations for, but not this. We have spent literally trillions and obligated trillions of dollars going forward. I've actually said this to some of my colleagues, and I've actually said it in public congressional hearings, that we are witnessing the greatest generational theft in the history of the world, because you basically your beautiful daughters you've got 3 of them under age 6. We are spending ahead. We are not saving ahead. We are spending ahead. There was a number of us working, and I would commend Congressman Schweikert, Congresswoman Lesko, Congressman Gosar, who are part of our delegation, who regularly work, but particularly David Schweikert, who sits on a special committee, to try to find ways to balance the budget. And he and I would talk frequently, and I look at that often myself. Many of the options that we had just 4 months ago, 5 months ago, have now been kind of drifted away because of the massive amount of debt we have. So the way that we have to address this is to confront this clearly without blinking that we have this problem. I don't think people can comprehend it. I mean, just as you said, mentioning $1 trillion is almost incomprehensible. Well, try talking $25 to $30 trillion in national debt. And you're right when you say a lot of these people they don't appreciate it because to them it's funny money. It's not out of their own pocket. But the reality is, many of us have urged a pay-for. So, for instance, the last bailout bill, which I voted no on, I urged us to have a pay for it, at least some of it. Find some way to pay for it. We've done that this time. We've urged pay-fors. And I will just say that, and quite frankly, as long as we do not hold our elected officials accountable on this, it will continue to be a problem. People like myself are here advocating specifically. I mean, when I ran the first time, that's what I was talking about. I said, I'm a pro-life candidate. That's my number one issue. But number 2 is always, how in the world can we become more fiscally responsible and start paring down our spending so we can get to a point where we can one day balance the budget? Because it's absolutely unsustainable at this point. One of the things that's saving us, quite frankly, is that we are the international currency of exchange, which gives us certain leverage and protects us. The other thing is as someone mentioned earlier, Jason, I believe it was, talking about the incredible low cost of money that the government borrows. Because if that ever moves up to a more normal and historical rate, the interest rate payment alone is going to squeeze out a significant number of other programs, not the least of which is the most important federal government responsibility, and that is our military and defense spending. So, Travis, you're right to be concerned. I'm glad you called. I can't talk about that enough. I can't advocate for it enough. And with that, we are now actually overtime a little bit, and I appreciate all of you who called in, all of you who listened, all of you who participated. Thank you so very much. And with that, we'll hope to have another one of these soon, and Godspeed to you, and be safe in the heat. Please be safe in the heat.